Hi, my name is Angel. Let's start with what is diabetes. So the definition of diabetes is that it is a condition where the body either doesn't produce enough insulin or it can't use it effectively, right? So it's not producing it, and even if it's producing, it's not using it the right way. Insulin is a hormone that helps glucose, sugar, right, from food enter your cells to be used for the energy, right? So insulin is a hormone that helps glucose, that we eat. Let's say we eat bread, let's say sugar, we eat cakes, butter, etc. So it helps sugar to be digested and released to the cells and used for the energy. Problem without enough insulin or proper insulin function, glucose builds up in the bloodstream, leading to high blood sugar levels, right? So, um, what actually happens is that if you do not have enough insulin or you don't have proper insulin function, sometimes glucose can build up in the bloodstream and lead to high blood sugar. What are the common symptoms of diabetes? Excessive thirst and frequent urination. Increased hunger, you're always hungry all the time. Fatigue and weakness, you feel very weak. Blurry vision, at times you can't see things. Slow healing sores. So you have sores, your foot ulcers are very common with diabetic patients. A frequent infection, sometimes you have skin infection, gum infection, vaginal infection is very common. Unexplained weight loss, especially for type 1, you have a lot of weight loss. So main symptoms of diabetes, it's eyes blurred, breath, smell of acetone. You can actually feel acetone. Nausea, vomiting, abdominal pain is also very common. Polyuria is very common. Glycosuria is also very common. Respiratory issue, hyperventilation is very common. For type 1, weight loss is also very common. What is the cause of diabetes? Genetic mutations that affect insulin production. Hormonal disease such as Cushing syndrome and acromegaly, right? So that is also one of the biggest causes. Injury to or removal of the pancreas or pancreatic cancer is one of the causes. Certain medications that affect insulin production or function can also be one of the causes. So what one can do, you have to take medication, manage the insulin level, do regular medical checkups. You can monitor blood sugar closely. Engage in physical activity is very important, so that's how you can burn your excess sugar. Focus on a healthy diet. It's very important to have a healthy diet, a balance of proteins and, carbs, and also take the right amount of nutrients. Try to manage the stress and educate yourself. It's important to read material with diabetes. Sometimes, we buy products and they may not have the right information mentioned on it. Have to do a little bit of research on what you consume on a daily basis, right? So what are the risk factors? Overweight, obesity, age 45 or older, especially when you're dealing with type 2 because that's, adult onset. Family history of diabetes, so genetics play a very important role as well. Physical inactivity less than 3 times a week. Let's say if you're not walking, you're not doing cardio, you're not stretching, at least walk for 2 miles, 5 miles per day, and that will do the magic. Okay. Certain ethnic backgrounds, such as African American, Hispanic, or Native Americans, may be high at risk for diabetes. Okay. All right, so management and treatment, lifestyle changes, healthy eating, regular exercise, weight management, very important, right? Medication, insulin for type 1, sometimes type 2, oral drugs for type 2. Monitoring regular blood sugar checks is also very important. Sometimes I have seen one of those medical devices that actually check your sugar levels, right? Education, diabetes, self-management, and support programs. Okay, so you will have to find a support program, if not, in person and online, that can actually guide you, or have a doctor and have a meeting with them. Let's say if you cannot visit them, at least do a telehealth appointment. All right, so as you can see, this person lost so much of weight, right? So you can also do the same, and that would actually help you with your diabetes. Best vegetables for diabetics. So I'm a vegetarian, so if you're a vegetarian, you can consume all these leafy vegetables, carrots, leafy greens, right? Kale, spinach, etc. Peppers, celery, very, very good. The minute you eat celery, you can actually feel the excess amount of energy that it releases. So it's also very good. Tomatoes, very important, right? They have an enzyme called stomatin that is very important for us. Cucumbers, very important. Mushrooms, I'm not a big fan of mushrooms. I don't like them, but if you do, I think they will help you. Onions, very important. My favorite are celery, onions, tomatoes, leafy greens. I eat a lot of carrots. I love eating eggplants, very important. Green beans, not so much. Broccoli and cauliflower are my favorite, right? So you can try eating all of these vegetables. They're very, very easily available. Another vegetable that's my favorite is bitter melon. So it looks like a squash, but it has like a, squiggles on it. It's a very awkward looking vegetable, but it has some huge benefits to it, right? Known for its blood sugar lowering effects due to compounds like carotene, right? So it's very important that you consume this. If you Google on Amazon, right? If you search on Amazon, right, you can very easily find Karela syrup or bitter melon syrup. It's very good for all the diabetic, type 1 or type 2. Fenugreek, very, very important, right? You can actually get fenugreek seeds. You can order it on Amazon if you like. It helps lower blood sugar levels by slowing carb absorption, right? So you can actually watch the other video that I have for carbohydrate metabolism. So if your body metabolizes carbs very quickly, it means it is absorbing sugar very faster, and that's why a lot many times we say, eat healthy carbs, chew slowly, allow the enzymes to do its magic, right? So fenugreek is really good. It comes in like yellow seeds, and you can try eating it. It will help you. You can add it in boiled water. It will help you. Turmeric, everybody knows turmeric, right? Contains curcumin, very important, which has anti-inflammatory properties and may improve insulin sensitivity. So turmeric is also very important. I usually love to drink golden milk. And you can add turmeric in your milk, heat it up, maybe add a little salt and drink it. Trust me, it will do wonders for you. It will do wonders. It not only helps you build a strong immune system, it helps your bones. You'll actually feel a change in your mood as well. So that's really awesome. All right, so types of diabetes. Type 1, autoimmune condition where the body attacks insulin producing cells, usually diagnosed in children or young adults. So type 1 is more juvenile, right? Type 2 is more adult based, right? Most common type, the body doesn't use insulin well, and the body's insulin resistant, right? Often linked to lifestyle and genetics. Type 2 is often linked to lifestyle and genetics. Gestational develops during pregnancy, usually resolves after birth, but increases future risk of type 2 diabetes. Pre-diabetes blood sugar is higher than normal, but not high enough for a diabetes diagnosis, can lead to type 2 if untreated, right? So these are two other types, gestational pre-diabetes, right? Just two different types, but they lead to type 1 or type 2. All right, type 1 diabetes is a chronic autoimmune disease, right? That occurs when the immune system attacks and destroys the insulin producing beta cells in the pancreas, right? Um, so what actually happens is that type 1 is an autoimmune disease. So that kind of means that our own body's immune system attacks and destroys the beta cells that are responsible for producing insulin in our pancreas. This leads to an absolute deficiency of insulin. You are actually just killing the cells responsible for insulin production. The chances are it's going to create absolute deficiency of insulin, which is essential for regulating blood glucose levels, right? So you don't really have the workers that are responsible for regulating blood glucose levels. So it's going to cause some serious issues. All right, so it requires daily management through insulin injections and blood sugar monitoring. The symptoms may include thirst, you're always thirsty, you frequently urinate a lot, right? Weight loss and fatigue is also very common. Currently, it cannot be prevented, it can be effectively treated. Approximately 1.25 million Americans are living with type 1, okay? So there is genetic susceptibility. Certain genes, especially HLA genes, increase the risk. Family history plays a role, but not all genetically predisposed individuals develop the disease, right? So the genetics do play a role, but not all of them are going to develop it. Like I said, it depends a lot on your lifestyle choices. Environmental triggers, viral infections, dietary factors, or gut microbiome changes, right? And these may initiate or accelerate the autoimmune response. Anything that kind of has an impact on autoimmunity will have some sort of impact on type 1 diabetes. And this is exactly why at times, patients have diabetes, they cannot actually, they have neuropathy issues. Why? Because the autoimmunity is not supporting them. Clinical onset symptoms appear when 80 to 90% of beta cells are destroyed. So, if you can actually see the symptoms when you have like absolute deficiency of your beta cells, or often presents with diabetic ketoacidosis in children or adults. The immune system produces autoantibodies against beta cell antigens, insulin, GAD65, glutamic acid decarboxylase, IA2, which is protein tyrosine phosphatase, ZNTA, zinc transporter. So we have insulin, we have glutamic acid decarboxylase, protein tyrosine phosphatase. These are all enzymes. One is a zinc transporter. So zinc is also very important. T cells infiltrate the pancreatic islets, insulitis, leading to progressive beta cell destruction. So our own body's immunity is impacting our T cells, right? Impacting our beta cells. Loss of insulin production. As beta cells die, insulin levels drop, okay? So there's an absolute deficiency. Without insulin, glucose cannot enter cells, leading to hyperglycemia, high blood sugar. So without insulin, glucose cannot enter the cells, right? So insulin actually is very important for regulation. Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, leading to high blood sugar levels and various health complications. So type 2 is more related to metabolism, versus type 1 is autoimmune, where our own body um, immunity impacts the beta cells, right? Type 2 diabetes occurs when the body either becomes resistant to insulin or doesn't produce enough insulin to maintain normal glucose levels. It is the most common form of diabetes. 90 to 95 of all diabetes cases are type 2, right? Because type 2 is more of adult versus juvenile, that's more relatable to type 1. While it primarily affects adults, increasing rates of obesity have led to more cases in children and adults, but mostly it's usually adults. 95% of the time, it starts, on the onset of adulthood. Type 2 diabetes develops through a complex interplay of insulin resistant beta cell dysfunction and metabolic disturbances. Insulin resistant. What happens? Muscle fat and liver cells stop responding properly to insulin. Results glucose can't enter cells efficiently, so it builds up in the bloodstream. Compensation, the pancreas produces more insulin, hyperinsulinemia, to try overcome the resistance, right? So muscle fat and liver cells stop responding properly to insulin. The glucose can't enter cells efficiently, so it builds up in the bloodstream. So we have extra glucose in the bloodstream, right? The pancreas produces more insulin, hyperinsulinemia, to try to overcome the resistance. There's a lot of resistance to enter the cells, so now pancreas are producing more insulin. Chronic stress, overworked pancreatic beta cells eventually become exhausted. Damage high glucose, glucotoxicity and fat levels, lipotoxicity, impair insulin production and secretion. So it impairs insulin production. Insulin level drops and blood sugar rises further. Hepatic glucose overproduction, liver malfunction. Yeah, in insulin resistant states, the liver continues to produce glucose even when it's not needed. So let's say an insulin resistant state, causes liver malfunction, right? That's why a lot many diabetic patients have, issues with their liver, all right? Mechanism: increased gluconeogenesis, reverse glycolysis, right? The glucose synthesis from non-carb sources contributes to hyperglycemia. So reverse, increased gluconeogenesis, glucose synthesis from non-carb sources will contribute to hyperglycemia. So that's the mechanism here, right? Excess of glucose, so now it's getting reversed. Cellular molecular disruption, post-receptor defects, abnormalities in insulin signaling pathways inside cells. So insulin signaling pathways inside the cell. So somewhere I feel that type 2 is more where it's not functioning properly, right? Glucose transport issues, impaired function of glucose transporter proteins, the impaired function, so it's not functioning properly. There is a fault in the mechanism, you know. Adipokine imbalance, obesity alters hormones like leptin. Leptin are, are stored in adipose tissues, right? Adiponectin, worsening insulin resistance, right? Inflammation, cytokines from fat tissue and immune cells promote insulin resistance and metabolic dysfunction. So inflammation, is one of the reasons why we have cellular and molecular disruptions, right? Inflammation, any part of the body, is going to create a chain reaction. Cytokines from fat tissue and immune cells promote insulin resistance and metabolic dysfunction. Why diabetes affects the feet? All right, so one is nerve damage. It causes peripheral neuropathy. I'm not sure, I personally had a job shadowing experience with a really good podiatrist, and he was constantly using microfilament for all the diabetic patients, right? So high blood sugar levels can damage nerves, especially in the feet. This leads to numbness or tingling, right? Loss of sensation, you might not feel the pain, and that's why diabetic patients just don't know if they've been hurt or not. Muscle weakness or imbalance, which can change foot shape, right? At times it will change the foot shape. They're either swollen, uh, you can actually feel it will change shape, okay? Poor circulation, peripheral artery disease, diabetes can narrow blood vessels, reducing blood flow to the feet. It slows healing and increases the risk of ulcers, infections, and gangrene. So this shows healing and increasing the risk of ulcers. So it may cause ulcer, infection, and gangrene, the tissue death. All right, and that's why gas gangrene and wet gangrenes are very common with diabetic patients. Right. So, what are the symptoms of peripheral neuropathy? Ulcers or slow healing wound. The wound doesn't get healed very quickly. Why? Because essentially it is an autoimmune disease, right? Shooting or burning pain constantly hurts. You have a jabbing pain, it burns. Why? Because there is an inflammation, right? We just saw the cytokines are coming into play, right? We also saw the T cells directly impact our beta cells, all right? Responsible for what? Insulin production, right? Sensitivity to touch. You can't touch it. It constantly feels like, oh my God, it hurts. Lack of sensation. You don't feel anything, all right, because your nerves, neuropathy. Apathy is disease of nerves, neuropathy, right? Increased falls, okay, because you can't feel anything. You don't feel like you're standing, you'll fall, right? Trouble sleeping is very common. You can't sleep. If you sleep at 2 hours, 3 hours, you will wake up and then go back to sleep, etc., etc. Difficulty walking is also very common. You walk like you're dizzy, you're having a hard time. Um, Tingly or numb feet is also very common. Okay. Foot ulcers are very common with diabetic foot patients. Open sores often found on pressure points like the ball of foot or heel can become infected and may lead to amputation if untreated. Alright, so as you can see, this is the ulcer, this is ulcer, and if this person is diabetic patient, chances are the patient has absolutely no idea he's having an ulcer. He doesn't feel anything, right? As you can see, this is an open sore, open ulcer, and there's reddish swelling around. I'm pretty sure it hurts when you touch it. It hurts when you walk, as you can see right here, and you can also see there's a little bit of blood circulation here. So you as you can see, this open sore, and it is very um, susceptible to all sorts of infection. This is exactly why gas gangrene and necrotic tissues increases, and that's why a lot many podiatrists use different type of treatments for debridement. For example, a maggot treatment. Fungal infections are also very common, includes athlete's foot and fungal nail infection causing itching, cracking, and thickened discolor nails. As you can see, this is discolor thickened nail. This is a fungal infection. You can call athlete's foot. It stinks a lot. It's really bad. And at times, the patient has absolutely no idea that they're even developing athlete's foot. Dry, cracked skin is very common, can lead to fissures that allow bacteria to enter. As you can see, this is an open fissure, there's little areas. Try walking on them barefoot, and I promise you it's going to cause some serious infection. All right. Can lead to fissures that allow bacteria to enter, often worsened by poor circulation. All right, so if there's no circulation, it's going to cause some serious trouble, especially if you're wearing real tight shoes, or you're wearing something, or you have an injury. It's going to make it even worse. All right, corns, calluses, and blisters caused by pressure or friction may become infected if not properly cared for. So this is a foot corn, as you can see right here. This is a callus right here, right? As you can see, this is a blister. It's gonna be a heat blister, it's gonna be a cold blister, but chances are, I promise you that most of these diabetic patients won't even have any feeling. They will only notice it when they actually see themselves with a mirror or somebody else catches them. That's exactly why going to a podiatrist on if you have diabetes is very important to go at least, for like a quarterly checkup to see if your foot is okay, if not as needed. Okay. All right, gangrene. So tissue dead due to lack of blood flow and infection. So there is lack of blood flow. Requires urgent medical attention and may result in amputation. Right, as you can see, these two, these are gangrenous. As you can see, the podiatrist had to amputate this second toe. As you can see, this one, right? During COVID, a lot many patients had issues with gangrene, especially the ones that had diabetes. Okay, this is gangrenous dead tissue. It turns blue and then it turns black. All right, as you can see, this particular patient also has presentation of nail fungus right here. Nail fungus, right? Very thickened skin, so the patient actually had diabetes. And this is a severe case, and as you can see, once it starts, it actually goes throughout your body. Why? Because slowly and gradually, the dead tissue is actually impacting your good tissue, and they're actually going upwards, right? Okay, so daily foot checkups are very important. Proper footwear is very important. Blood sugar control are key to preventing complications. So the basic line is blood sugar control. So a healthy diet, eating green leafy vegetables, mixing up with, you can do Pilates, you can do Zumba, you can do cardio, you can walk for 2 miles. On an average, I think everyone should walk for 2 to 5 miles. Okay. If you notice any changes like redness, swelling, or sore, see a healthcare provider promptly. This is a microfilament, and that's how a podiatrist would check. All right. Um, what this podiatrist is essentially doing is, checking neuropathy. Like, do you feel any sensation? And that's why it's very, very thin. Because if you can feel this particular thin wire, then chances are your foot is intact. Your sensations are intact. As you can see, this foot is very healthy. The medial malleolus is right here. There is no arch issue. As you can see, it's very well maintained. However, if this patient has diabetes, it is always important to go for a checkup, right? But I do kind of feel that this patient has calluses issues and they keep them maintained, right? You can see the dry skin are right here, okay? And there's a little bit of presentation of bunions right here. As you can see, the toe hasn't outgrown. All right. So if you have diabetes, if you have a patient with diabetes, if you're a student struggling with diabetes, just make sure you go for daily foot checks, wear the proper type of shoe. A lot of shoe that we find at retail stores may not be right for us. You have to get like a specialized diabetes, shoe. You can look into your community footwear stores. They will have specialized. If not, they'll design them for you, right? I've seen some stores design footwear. You can go ahead and check it out wherever you live, right? So just to be a little cognizant of things that you do and try to manage it. There is no cure for it until you have to literally a lot many patients that I have personally noticed, as a student, right? I have noticed that if their weight is too high and they have diabetes, they try to do as much as you can and they reduce the weight and they try to control it. So weight reduction is the bottom line, right? We saw adipose tissue playing a role. We saw leptin playing a role. We saw cytokines playing a role. Autoimmunity is a basic need, right? So sugar, insulin production, reduction, not functioning properly, all those conditions should be managed. All right. So allow your body to help. First help your body and allow the body to help you. All right. I hope this helps. Thank you. Bye. All right, so if you like this video, subscribe, like, share, comment, and tell me if you want to see more diabetes videos. Bye.